Hello, my name is Nerissa Recinos, and this is my final project for my Blue Cross Blue Shield strategic plan. I want to begin by going over again Blue Cross Blue Shield's mission, values, and vision. They have a mission to want to improve the overall health of their communities that they serve. Their vision strives on attaining affordable and safe quality care. And their values take on the form of focusing on their many strengths and beliefs. They want to deliver great care to their customers and make great decisions within healthcare when doing so. And their value, once again, focuses on fairness, honesty, and learning from their mistakes. Through the gap analysis that I conducted for Blue Cross Blue Shield, there were quite a few gaps that came apparent that need to be addressed. For starters, the need for health equity in more underserved communities. At the moment, this is not fully achieved due to the lack of data equity within the U.S. health system. The next being the lack of transparency and inclusivity in some of their mission statements and their overarching values, excuse me. There is a lack of transparent planning, and it only hurts the patient in the long run, therefore allowing for more information to be public. This then allows the patient to feel more involved in their healthcare. The next being the lack of infrastructure for telehealth related services specifically. There needs to be more resources for telehealth services to be implemented nationwide. The overall need for staffing that is diverse, well trained in telemedicine, and competent in care coordination, and the need for Medicaid plans and related services to be expanded upon, and not all states have done this for their plans. For my first strategy, this would be allocating funds/spending towards diversity spending to help with health disparities to improve overall health equity. For the objectives to be able to achieve this strategy, it would be identifying minority-owned businesses/organizations for funding, incorporate health equity investments in payer mergers, acquisitions, transactions, etc., as this has a more positive and significant impact on healthcare cost growth and overall health outcomes. And lastly, identifying local partners to support local minority communities and underserved communities as well. As for my second strategy, it would be redefining network adequacy. As for the objectives to achieve this, it would be expanding benefits in current Medicaid/health plans, identifying care providers across their geographic areas to determine the accessibility to current members, and finally, identifying current appointment times and being able to establish a standard for diverse types of services. As for my third strategy, it would look like investing in implementing telehealth programs/services to improve health equity. As for the objectives to be able to achieve this, it would be identifying geographic areas needing telehealth services and then formulating a plan. This would also look like focusing on rural areas generally, as they need more attention in that regard. Secondly, finding telehealth services to implement requirements needed for said services. And finally, finding correct training modules to evolve current staffing for a change. And being able to find what works for your staff, as this would be imperative when implementing new services such as this, especially telemedicine related services. As for my fourth and final strategy, it would be implementing policies to improve health equity/pay for equity. As for my objectives to be able to achieve this, it begins with openly addressing health inequities as a company and collecting data from current members, as this helps determine the root cause to enable sustainable interventions. Secondly, it would be implementing programs in Medicare/Medicaid plans that are incentivized to address inequities. And finally, addressing the need to increase a diverse workforce and putting focus on more at-risk communities. As for this slide, this would be my balanced scorecard for this presentation. I first want to put focus on the two sources that you see on the right side, as they help me directly create this and find more appropriate information when creating this, such as when discussing the various target percentages and KPIs, as I want to be as realistic and accurate as possible and not just spewing random numbers when actually wanting to achieve such targets. For example, let's take, for example, the first strategy, my allocating funds slash spending towards diversity spending, and my first objective being identifying minority-owned businesses, and the direct KPI for that would be to be able to determine that it was achieved is the percentage of minority businesses receiving funds, and hopefully that being more than 10%, at least within a year. And this initiative to take this would be formulating a team catered towards minority communities and creating various plans to tackle high labor costs. Another example we could go over is my strategy discussing implementing policies to improve overall health equity and looking specifically at the objective that says addressing the need to increase workforce capacity, henceforth the KPI for that being developing an organizational infrastructure checklist, and the target being at least completing 98% of that, showcasing that that was achieved. And the initiative for this being achieved as well would be revamping incentivized care programs. And finally, another example we could also go over is my redefining network adequacy, and we can look at two different objectives here. First, let's look at the one discussing expanding benefits in current Medicaid programs, the KPI being the number of states that have expanded Medicaid, and the target being greater than 95% within 10 years, being more realistic because that's taking into consideration all the different policies and laws that would um, take for that to happen. And then we look at another objective, which is identifying care provider accessibility to current members in different geographic areas across the nation. The KPI being the percentage care providers for different rural geographic areas, and hopefully being at least 80% by the end of the quarter. And this initiative can take place by hiring new admin staff and formulating a department that focuses specifically on rural healthcare concerns and projects in different areas. But as you can see as well, to look more into this, there are various KPIs put in place for the different strategies to help showcase targets and different initiatives that can be taken to help achieve all of these strategies. As for my overall analysis, I was able to surmise that, especially utilizing the scorecard that we created, a lot of the gaps do align with the health inequities that are present. There is a need for better staffing and well-trained staffing in a variety of different areas, such as needing staffing that can train others and acclimate to new settings and new programs being integrated, such as in discussion here, telemedicine related services, programs, and equipment. And finally, the need for being able to utilize different KPIs to be able to reach short-term goals and then being able to achieve each strategy overall. As for the summary of my overall strategy recommendations, I realized that a lot of these strategies really do come down to needing to be able to allocate the appropriate funds to better aid towards improving health equity of their current members, and it comes down to revamping the overall network to improve the outreach towards rural and more minority communities. It also comes down to allocating spending towards integrating diversity spending and implementing telehealth related services. And as well, it looks like being able to aid towards the overall fight for better Medicaid plans that implement policies to align with more so incentivized care plans. There is an overall goal present of being able to improve health equity and being able to align with their current directional strategy overall. Finally, we go over the summary of my needed resources. This looks like staff trained for diversity, inclusion, training, and tactics, as this will have a direct impact on human resources by adding to current staff, and will have an impact on financial resources by needing funds to pay and keep this staff permanently. Secondly, the need for staff trained for telemedicine/health services and equipment. This will have an impact on human resources by adding to their current staff, and will also have an impact on financial funds needed to cover costs of training and other related training modules. Third, there would be hiring new administrative staff for coordination and related needs related to care providers, as this will also have an impact on human resources by adding to current staff, and will have an impact on financial funds needed to cover costs of training and other related training modules as well. Finally, overall, there is a need for more staff, medical devices, materials, facilities, and other related supplies to be able to implement a new department overall, as this will have a direct impact on human resources by needing staff for this department to be able to be implemented correctly and be able to be sustainable overall. And finally, that we see here, these are the specific references that I used throughout my presentation. I want to thank you for watching and listening to my presentation. Thank you very much, and goodbye.